just a little bit about People of Yuma Health Association. It's a non-profit organization. We have 4 goals. We change a little bit. Weight loss is one of them. Opioid epidemic reduction is the second one. And I think the weight loss and reduction on the opioids is linked, because as we lose weight, you would need less pain medications or none as the back pain gets better. Second medical opinion, if you guys need help with medical conditions which is not being diagnosed with another doctor, we can help with that, and then also patient education, which we are doing right now. So now going back to the topic for the day, we tend to keep it like focused so you guys don't go into sleep mode. So I'll make it to the point, and then when I'm done, you can ask the questions, and we'll go from there. So new ways to treat back pain. I know the back pain is very common, one of the most common medical problem in our patient population, and we know the conventional treatment, the physical therapy, the injections, the surgery, the pain management, the opioids and everything. So first, just a basic anatomy. So we have a cervical spine, thoracic spine, lumbar spine, and a sacral spine. So that's like 4 portions of them. There's 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and there's 1 piece. So some patients have more than sometimes extra vertebra, but generally that's the normal anatomy. Just a little bit more closer look up into the spine. So we have vertebrae, disc, vertebrae, disc. The disc is like a cushion between the vertebrae. Vertebrae are bones, and you can see one vertebra is sitting on top of the second vertebra, and likewise. And this thing right here is known as facet joint. This is a junction between those 2 vertebrae. There's a joint, just like a knee joint. It has a little small joint there. We call it facet joint. And the reason is you need to know that sometimes doctor will say you're going to need a facet joint injection. So that's where they inject, right in this spot. There are different kind of injections. We'll talk about the injections when we get close to that topic. So, the most common cause of back pain is, people have disc herniation, like this disc will protrude backwards and hit on the nerve, or this hole will become small and will pinch the nerve, and sometimes the fracture of the vertebra. But these are the 2 most common causes, like disc herniation, nerve impingement right here, or arthritis of this joint, facet joint. So 3 causes most commonly we see for the back pain. So that's actually a physical therapy. It's not some other thing going on. I just got it from Google search. I don't know how it's going to help, but apparently. Well, the topic was new ways of treating back pain, I guess. Well, the point is physical therapy does help the back pain, and the way it helps is that we are building up the core muscles. So instead of the weight being pushed on the back, is being handled by the muscles of the back. And there are quite a bit of muscles, the belly muscle in the front, the back muscle in the back. And what the physical therapists do in the back pain, they try to strengthen those core muscles, so the back doesn't have to take the hit. It's just handled by the muscles of the back, because we generally don't do the exercise for the back. In our day-to-day life, we are walking, we are doing things like that, but we are not exercising the back per se. For the back exercise is different exercise, so you have to just do it. So if the back pain becomes really bad, one of the treatment is physical therapy to increase the core strength of the muscles, and also sometimes they do the stretching. So if there's a nerve impingement, they can stretch your back. So try to relieve the pressure from the pinched nerve. So that's why we do recommend physical therapy, here and there, because it does help. Meditations. I mean, please don't do it yourself at this home. This is under supervision. I mean, this guy is sitting on the edge of something. Pain is a perception. I mean, some people have high pain thresholds and some people have lower pain threshold. And you can see in state of emergencies, you will cut your hand or something, and you wouldn't feel a pain at that time because of the endorphins being released in the brain will override your pain. So some people have low pain threshold. So if you put your mind to it or try to relax, your pain will become also less, So that's part of the treatment. And the diet, she's not edible yet. But the idea is that there's some foods which are have inflammations. The food with the high glycemic index, like sugars, high sugars, like simple sugars, or food high in fat, they causes inflammation in the body, and they can cause the joint pains and back pain. So eliminating those diets, and I'm sure if you go to a rheumatologist, they will say, you know what, don't eat these kind of diet, and that might help. So everything helps a little bit.
Hey there, you are currently watching the Dr. Fazil Show, sponsored by the people of Yuma Health Association.
Oh yes, lifestyle modification. So if you have a back pain, please don't do this thing. So I mean, the problem is that sometimes people get their back pain get better, and they start to do more things than they have never done before, and the pain come right back. So once you get a surgery done in the back is already weak, so you're never going to go to your original state what you had before, And as all we get older, the space between the vertebrae become less, and your you will get injured easily. So you're never going to go to your original state what you had before, And as all we get older, the space between the vertebrae become less, and your you will get injured easily. Your nerve would be get impinged easily because the space is not that much as you were younger. So things wouldn't be the same. So you have to become more careful how you handle your back, So if you were doing some kind of activities back in the days, and if you start to hurt, then your body is telling you stop doing that activity because things have changed, So that's the thing we need to know that. So if you're hurting your back, if you do certain things, please don't do it. Inversion therapy, people do ask about those the guy who sell those whatever the hang thing on the TV all the time. I don't know if you have seen the commercial. Yeah. Yes. So it works, but there's few contraindications. You have to be careful. If you have a heart problem or a hypertension or glaucoma, do not do it, please, because after 2 minutes of hanging upside down, your blood pressure will start to go up, and also the pressure in the eyes will go high. And if you already have glaucoma, you can make it worse. And same thing, if you have a congestive heart failure, you might go into congestive heart failure as well. So not recommended for everybody. You can do it for here and there for acute pain. It's not going to cure everything, but the idea is to stretch your lower back. Now you can do also for the neck. And you use your imagination how you're going to do it. So back injections. So in back injections, and we do back injections all the time, and there are different kinds. So just have to remember that. So we talked about the facet joints. If you do injection in if doctor feel the pain is from arthritis, they will do injection in the facet joint. And if it does get better, then they can do a radio frequency or like laser nerve ablation because there's a nerve which supplies that joint, so they can burn it. So if it is burned, apparently the pain should be cured for years, and it happens. But the diagnosis has to be accurate. And the other shots which could be given is epidural shots. So there's a big space around the spine, and there's a hole in the tailbone, and you just inject it there. And that medication spread like a cortisone spread throughout the spine, and it reduces the inflammation. So generally, I think, practically speaking, there are only two kinds